Now, what causes hip joint osteoarthritis? As I've told you that we can primarily divide hip joint osteoarthritis as primary or secondary hip joint osteoarthritis. Primary is one which is there is no underlying cause, but over the period of time, as it has the patient has aged enough, there is actually progressive degeneration of the hip joint leading to primary hip joint osteoarthritis. Secondary is when there is underlying problem or an underlying cause which is actually accelerating the osteoarthritis, which may eventually develop later on in life, leading to secondary osteoarthritis at the hip joint. Now, causes of this secondary osteoarthritis of hip joint could be mechanical or non-mechanical. They can be broadly divided into two causes. Mechanical causes are all those causes which actually disturb the mechanics of the hip joint. As you know, the axial load or weight of the body has to transfer from the spine, then to the sacroiliac joint, and then go towards the hip joint, and then going into the lower limbs as well. And so as this joint has a role in weight bearing of the body, therefore once the mechanics would be disturbed, the forces transmitted through the hip joint would also alter. And there may be increased forces transmitting to certain area, and there may be increased shielding of the forces from certain area. Now this will kind of produce where there will be increased forces from where they will be transmitted, that will lead to increased accelerated degeneration, and where there will be increased shielding, the bone will resorb and eventually become more osteopenic. So in all cases, this actually starts to create more problem for the hip joint. The bone part of the bone which is actually transmitting the force becomes degenerated, and other part becomes weak and osteopenic. So you can very well imagine eventually this will lead to collapse or sort of a collapse of the mechanical function of the hip joint. Now, what are the most important cause? The major cause is developmental dysplasia of the hip. In developmental dysplasia is called as because there is pathoanatomy is such that there is actually altered biomechanics due to, for example, the acetabulum may be retroverted or actually abnormal, or there may be more shallow, and the proximal femoral head may be more higher up, or maybe subluxed or completely dislocated. All these problems may be corrected or may not be corrected. If they are not corrected, then that patient usually develops osteoarthritis as early as 20s when he's in early 20s. But if it's corrected to some extent, then there is some that osteoarthritis is delayed to an extent. Let's say the patient usually develops in the early 30s or in the late 30s. But eventually, because there is a mechanical problem at the hip joint, this will eventually lead to osteoarthritis. Then is the femoroacetabular impingement. This is one of the very important causes of the osteoarthritis. Actually, femoroacetabular impingement can be simplified in form of that has to femoral head articulates with the acetabular socket. If there is something wrong with the acetabulum, and whenever the patient is moving, for example, patient is flexing the hip joint or externally internally rotating, there will be some articulation at the femoral head and neck level along towards the acetabulum. Therefore, once this impinge each other due to any abnormality of the acetabulum or abnormality of the femoral head or neck, this can lead to labral tears, cartilage degeneration, because at certain point they will cause the cartilage and labrum to grind between each other, leading to tear and then coming back. For example, instead of having an acetabulum, if this is an acetabulum and it should normally be having a 45 degree of inclination with 10 to 20 degree of antiversion. A normal angle antiversion like this, and this is how the flexion or external rotation is occurring. If instead of having this becomes more retroverted and this is happening, now the problem is this area and this area is more exposed. As a result, degeneration will start more anteriorly towards over the femoral neck. And this is classically happens when there is underlying problem with the acetabulum or problem with the head of the femur, the neck of the femur. Then there are certain diseases of the hip joint. For example, patient may develop leg calf Perthes disease at the age of 4 to 8 years, usually more common in boys, or they may have associated hypothyroidism, hypopituitarism, and may be more liable of development slipped capital femoral epiphysis at the adolescent age. For example, if that child even if that child is treated, there is always a chance that they would lead to increased osteoarthritis, and there will be present with osteoarthritis at a much early age as compared to a normal degenerative osteoarthritis. Then other causes are mostly post-traumatic. As I've told you, the patient usually if having a head and neck fracture of the femur, or if there is associated femoral acetabular fracture or pelvic fractures, these patients have a tendency to develop osteoarthritis early despite being adequately treated. And that is why the acetabular fractures and pelvic fractures should be appropriately treated, because if anatomical reduction is not done, this would lead to subsequent osteoarthritis, and then patient may require the replacement of the hip joint rather than some form of a open reduction or some form of osteosynthesis which can be done at the hip and pelvis. Other non-mechanical causes include certain problems which are not related to the mechanics, but rather there is actually the structure is fine, the mechanics are fine, but the problem is with the other areas. For example, avascular necrosis of femoral head could be due to underlying patient may be alcoholic. Patient may have increased tendency to having smoking, and alcohol actually predisposes the patient to increase avascular necrosis of the femoral head. The patient may have ankylosing spondylitis. In our patient, she was having a back pain. She was having a sacroiliac joint pain. She was already there was already chiropractor who was doing some form of a treatment. Therefore, there was something wrong with the lumbar spine or even the cervical spine as well. Usually in ankylosing spondylitis, as the problem is in the lumbar spine and the sacroiliac joint, but the pain mimics the hip joint because usually radiating towards the groin as well as the thigh. Therefore, whenever you have a patient who is coming up with the hip joint pain, you must rule out lumbar spine pathologies such as ankylosing spondylitis, discitis, even herniated nucleus pulposus as well, because all these conditions can mimic sometimes with the hip pain. Therefore, you have to rule out the non-mechanical causes as well. Then inflammatory arthritis. The patient may be having a rheumatoid arthritis as well, and our problems such as non-rheumatoid arthritis such as psoriatic arthritis as well. And these, if other joints can also be involved, but usually if these arthritis usually present with the hip joint, mostly they are bilateral, and there is always associated past medical history as well. So whenever you are taking a history of a hip joint pain, you have to keep all these differentials in the mind. The first thing, which is always the age. At the 51 years of age, yes, most likely it can be primary, but you have to rule out all the secondary causes of the things as well. For example, our patient was non-smoker, was non-alcoholic. Although there was history of trauma 3 months back, therefore you have to expect that there could be that trauma could lead to post-traumatic osteoarthritis at the hip joint. But she was having back pain, she was having a neck pain as well, and she was seeking chiropractor as well. Therefore, you have to rule out ankylosing spondylitis. You have to rule out lumbar spine pathologies as well. Therefore, to be sure that this is actually the problem is at the hip joint, not at the spine.